Hi everybody. Still thanking you, Arnold, for all of your goodness of letting me use your friend Megan here. So anyhow, I just want to give you guys a real brief overview of what we're going to do here. So Megan has an uneven pelvis here, right? And she's got some she's got some chronic head and neck issues, and she's got some trigger points and so forth. And so when I examined her last week, I found some things, and it was the other day that Joey said that he was going to gift her some work. So here we are. We're going to give her some really good works to try to work out some of these long-standing musculoskeletal complaints. Now, for people who have musculoskeletal complaints, it can be very difficult to find a practitioner that's very well versed in how to correct these things. A lot of our training is not so complete and perfect, so sometimes we have to learn a lot of things on our own. So anyhow, I'm going to just start, and then we're going to, at the end, we're going to give a little bit of a summary. So just to give you an idea of what we do, she's got an uneven pelvis on the right that's going posterior and inferior. So what we do here is, rather than just do a lot of cracking and crunching of the joints and so forth, and try to force joints to move, we like to really work on things properly so that the joints will move by themselves. Just with a little bit of a passive influence by myself as the doctor. I'm formally trained as a chiropractor, but I like to see joints move easily. I don't like to force things, because otherwise I'm not going to get any long-term results. So what we're going to do here is, with the pelvis, we're going to start with the pelvis, and we're going to work our way up. We're going to work out all of the hypertonicity, all of the tightness in the muscles and trigger points, and we're going to release them. And once we release those things around all those structures around the joints, you'll see that the joints will actually start to move much more easily, more freely, and relief should be the term that we're looking for, and that the patient should feel. If the patient doesn't feel results, then I haven't done a good job. So we'll see at the end how well it works out. So we'll touch base again. Thank you for listening. Hi there, guys. This is part 2 of what we just started with earlier this morning on the session that we had with Megan. We had a really nice session, and just to give you a little bit of a background on what kind of work I did today, and what generally kind of work I do. When there's musculoskeletal complaints, structural issues, pain, if there's radicular pain, meaning pain that goes to different parts of the body, what we try to do is we try to pinpoint what exactly is going on in the body. And what we want to do is we want to establish normal motion. So in order to establish normal motion, it's a process, right? With any type of disease, musculoskeletal diseases included, may not use the term disease rather than the more common term to use with musculoskeletal issues is the condition. But the process of getting to that type of situation is the same. It's built up over time, and there's phases of and progression of that condition. So in order to relieve any type of musculoskeletal type of issues, you also have to reverse that process in order to get long-term results and relief from that. So, as with fasting, that's the reason why I like fasting so much, because fasting you actually have the opportunity to be able to reverse the causes of that condition or that disease or the illness. And the same thing with the kind of body work that I do. I try to take the same type of mindset to try to reverse that. So that's why I don't go in and just do type of quick fix type of manipulative therapy that I was taught as going through chiropractic school. Rather, I learned not only techniques from other chiropractors, but I learned techniques that I also found in school, but just weren't focused on. So if you focus on doing the right things to be able to reverse the cause of the condition, you can get really good results. So in order to reverse that condition that's generally causing pain or abnormal motion or a structural imbalance, you need to release what is going on. And so oftentimes ligaments and tendons and muscles are very tight, which you call a hypertonic situation. So in order to release that hypertonicity, you need to get deep into the tissues to be able to do that. And so a lot of these tendons and ligaments, and especially in the lower back and mid back, you've got 3 layers of very deep muscles. So you have to be able to know how to slowly release that tension. And then from there we use mobilization types of techniques to be able to establish normal motion. So I use a lot of Rolfing, and I use a lot of myofascial release techniques in order to be able to do this. And then I use a lot of chiropractic and manipulative types of therapy with using mobilization and non-force types of manipulation. I like to see things move without force. If I have to use force to be able to get something to move properly, there's probably something that I haven't done in order to allow that to be able to happen. So anyhow, that's a little bit more talk than what I planned to give, so I hope you didn't get too bored. And now we're just going to ask Megan, because she's had some experience now with the type of work that I do, and so we're going to find out what she thought about it.
So I just had almost a 2-hour session with Dr. Nick, and the techniques that he was talking about are great. They've really helped me out. I feel very loosened up. I'm usually very tight in my neck and shoulders, and sometimes I can have some low back pain and hip pain. And I feel very loose right now. And during the massage, or whatever you're gonna call it, it was very relaxing. There's definitely, when you hit some pressure points, it can get a little painful, but that's the way it is with all body work like that. But it was mostly relaxing and very enjoyable. And then afterwards, I sort of felt kind of more awake than I did before I started. So it was a really good experience, and if I had unlimited funds, I would probably do this every day. So, I mean, it definitely helped loosen up my hips and everything. I definitely had some pain going on, and last night I was tossing and turning just because I had different muscle aches, and so it really helped clear that up, and I'm very satisfied with my results. So, thank you.
Alright, so I guess we're signing off from the Arnold Television Network.
Yep, okay, we'll see you soon.
Bye.